All right, that's recorded. And then before I kick it off to Tracy, who will introduce herself and what we're going to be talking about this evening, I am monitoring the chat as well. So if you have any questions while we're discussing different things and you just want to throw it in the chat, feel free to do that. And then we will try and answer all of those at the end after we get talking. So Tracy, if you want to go ahead and get started.
Yeah, so hello, I am Tracy Bath, and I am with Columbia Boone County Public Health and Human Services. I'm a health educator, but I'm also the COVID business lead or business guidance liaison. And so what that means is that we give guidance to businesses, and businesses include places of worship also, and non-for-profits and congregate settings and all kinds of things. And so, this is one of a series of town halls or meetings that we've done. So we have done them with hoteliers, with bars and restaurants. We've done a general business town hall that I think is up on our YouTube station. And then we've also done them for Greek housing here in Columbia, and then also for our homeless shelters. So we've done quite a few different town halls or meetings. And so we are humbled and privileged to do another one tonight with our faith leaders. We thank you all for coming so much. You are vital to our community. You are vital to your own community. We're here tonight to kind of share some stories about what is going on as COVID health in our community and share guidance. But this is also an opportunity. This is a conversation for you to share what mitigation efforts you're doing or questions you have. We will have other panelists that are health panelists that are here to answer any questions. So, thank you again for coming. You are on the spiritual front lines of not only COVID, of everything that's going on right now, mental health issues and physical health issues. And we want to protect you and keep you safe in public health and your communities and congregation, and arm you with any knowledge or tools that you may need to do that, because we're all working together as a community. So now I'm going to hand this off for our distinguished moderator, Verna LeBoy. And Verna is a health educator as well with me, and she's also the lead for the award-winning program, Live Well by Faith. And so I'm going to toss it to Verna.
This is so exciting, and I'm so thankful, Tracy, that you had the presence of mind to think to reach out to our faith community, because really they are the glue that's keeping us sane and together out here right now during this pandemic. I would like to allow our panelists to introduce themselves if they would. I'd like to Lynell Phillips to introduce herself, and then Dr. Kate Grossman and Ashton Day, if you would, and then we'll go from there. So Lynell,
hi,
welcome.
thank you, Verna. And I want to echo your thoughts. Honestly, it's my church community that's getting me and my family through this. So for the clergy out there, bless you. Thank you for all you do. I think you're making more of an impact than you realize. And so I'm representing the Board of Health, our Columbia Boone County Board of Health here today. I'm also an assistant teaching professor at the University of Missouri in the Department of Public Health. In my specialty areas, used to be really obscure, communicable disease and immunizations, but it's super popular right now. So I have served on my church COVID task force. And I have to say, of all of the activities that I've been involved in on campus and in our state in terms of COVID, I think that task force and the multitude of decisions and minutia that you have to think through, it's really complicated. So that was like one of the most challenging efforts I was involved in, is my COVID church task force. So anyway, I'm have a big heart for all of your challenges right now. And Ashton?
Ashton?
Yeah, Yeah, so I'm Ashton Day. I'm a health educator at the Columbia Boone County Public Health and Human Services Department. A big part of my role during COVID has been helping our health promotions team make guidance for different groups of people throughout our community, and then also communicating that on social media, different TV interviews, media stuff, just trying to spread this information out as much as possible right now. Dr. Grossman?
All right. My name is Kate Grossman. I'm a pulmonary and critical care physician. I work at Boone Hospital, both in the inpatient and outpatient side. So I'm a ICU physician and a pulmonary physician in the hospital. And I also have a pulmonary clinic where I see patients with chronic lung disease from the community. And I'm so pleased to be here with you all talking about this really important topic.
Is Dr. Millam on?
If Dr. Ashley Millaham, the medical director from
No,
the
there
health
she is.
department, is available, could she please introduce herself?
Yes, hi, thank you. Sorry for my tardiness today. I got a bit behind in clinic, and so I'm Dr. Ashley Millam. I am the medical director at Columbia Boone County Department of Public Health and Human Services, and then I'm also a family physician here in town. And so I'm just really excited for us to be gathering to have this conversation to figure out how we can all just work best together for our community. So thank you to everyone who's here, and thanks for having me be a part of it.
Awesome. You know, I love the work that I do in public health, and I love staying connected to all the experts. I am honored this evening to have Dr. Kate Grossman, who's a pulmonary and critical care physician at Boone Hospital Center right here in Columbia, Missouri. And I'm also honored because I've heard her passion and what the critical care nurses and docs are providing in the ICU units. And so she'll be able to bring us stories from that lens that none of us would be able to have access to unless she brought it to us. She's the one that's looking into the eyes and the face of our loved ones who are battling this virus alone in the ICU unit, fighting for their lives while we're out here praying. She's the one, she's a wife and mother of two, and her staff are risking their lives daily on the front lines. And so we brought the frontline stories to you. So without further ado, Dr. Kate Grossman, thank you.
All right, thank you. So I think this is such an important talk, and I truly feel that this is the most important thing that I could be doing right now. And I'm actually on service in the ICU and caring for patients this week. But I think this provides us such an amazing opportunity to talk to people who are truly on the front lines. You know, a lot has been spoken about being on the front line as being a healthcare worker. But what's become very obvious is that it's really community leaders that are on the front lines. And as healthcare workers, we kind of end up being the last line of defense. By the time we're seeing patients, they're really sick, and everything that we're doing for them is really to try and get them through this and to save their life. But you know, we have such an opportunity up front to really interact with community leaders, with faith leaders who have such an important voice and such an important platform to be able to provide good care to their congregants. So I truly cannot think of a more important place for me to be right now. As faith leaders, as pastors, as reverends, you all are truly leaders in the community. You provide incredible service to your congregations and to the local communities that you serve. And that is clearly so important right now, and something that people are clamoring for. It provides a sense of normalcy. It provides spiritual care. emotional care, social interactions, and really, has been able to pull people together at a time that we're hesitant to be pulled together. And so I think that you have such an important voice and such an important role. And as a healthcare worker, I see that we have completely common goals. Our common goals are to protect and to care for the community, the Mid-Missouri community, and to be able to support the people of Mid-Missouri through a really difficult time. And I consider us allies in working together for this common goal. And my role here today is really to provide a window into the hospital, and to let you see what we're seeing in the hospital, because it's really hard to imagine it. I would say back in the spring, it was even harder to imagine it because we weren't seeing that many cases out here. We had a few cases in the hospital. We had even fewer cases, when it kind of gets diluted out to the community and to different congregations and different, more rural areas. So, it's hard to kind of hear about something that you're not seeing and really be able to take that in and understand what it means. And over the last few weeks to months, what we've seen here locally in the hospital, in the community, and I'm sure in your congregations, is that we are seeing more and more cases. And what, was kind of vague, and difficult to imagine in the spring, is real and is affecting the lives of people that we love and who we want to protect. I would say that in the hospital right now, a common theme that we are seeing is that when we talk with patients who are coming in and who are sick, they very commonly are shocked that they're sick with COVID. They feel that they're being safe. They feel like they're trying to stay out of, the public and be, careful when they can. But one of the most common things that I'm hearing is that people say, well, I don't know how I would have gotten this. I really haven't been going out. I've only been going to church. And it's such a common theme because people feel safe at church, because church is meeting such an important role in lives right now. And so the question is, how do we keep people safe while providing for this important need that our whole community is feeling right now? Practicing medicine right now is difficult. This is not a way that any healthcare provider wants to practice medicine. One of the things that I love about medicine is getting to know patients and getting to know kind of not just their illness, but who they are in their family and in their community, and all of those amazing interactions and important interactions. And my colleagues at Boone feel similarly. We love having family members at the bedside. It provides a really important window into who the patient is, especially in the ICU when a lot of our patients aren't able to really speak for themselves. So practicing right now where, we don't have family at the bedside, where, we're having to update family members who are home and who are a little bit kind of helpless and waiting for our updates is really hard, and trying to explain a lot of complexities over the phone or over an iPad is really difficult. I can very honestly say that this is the busiest that I have seen the ICU in my years of practice, and that these are the sickest patients that I've ever taken care of in the ICU. I can very honestly say that these are the most scared patients I've ever taken care of in the ICU, and that having family conversations and family meetings in a way that we don't normally do, over Zoom or over FaceTime or over the phone is incredibly difficult. And I say this both as a physician and as someone who's lived through this. My brother-in-law was on a ventilator in New Orleans back in March and April. And, we had to be the family that was waiting to hear from the physicians at the end of the night, and very anxious throughout the day until we got our update. And kind of reliant on the healthcare workers and very grateful for them. But it's a really difficult role to be in on both sides. And I imagine as clergy and as in faith leaders and people in the community that your congregants are turning to during this time, it's probably very difficult for you all as well to be able to give guidance when you're used to kind of being able to go in and sit with patients and pray with them and be part of this really difficult time for both the patients and the families. I can tell you that the staff that I work with, the nurses, the mid-level providers, the respiratory therapists, the techs, my other physician colleagues, this is exhausting. It's exhausting taking care of this sick a patient and this many patients. It's exhausting trying to provide not just medical care, but emotional support and spiritual support to both patients and to families. So this is a really trying time, both to be a faith leader, to be a patient, to be a family member, and to be a healthcare worker. So we're kind of seeing this from all angles. And I think one of the interesting things that I've seen, especially locally, is that there's a bit of a disconnect between what's going on in the hospital and what's going on in the community. And it makes sense because the hospital is kind of walled off right now. And it feels very surreal, not to be a part of that and not to be seeing that and maybe to be seeing reports on the news and other places. And I can tell you that reports on the news that you're seeing other places is what it looks like in Columbia right now. It's what it looks like at Boone. It's what it looks like at the university, at the VA hospital. If you're seeing reports from Texas and from other places that are struggling right now, picture your community members who are nurses and doctors and in the hospital. That this is what we're seeing every day too. And a kind of a couple of, I guess, anecdotal stories of families and patients that we're trying to get through this. We're seeing that patients are relying on things that kind of provide normalcy, like church, like seeing their family, like being able to get together for family dinners or for holidays. And it's providing a serious emotional, mental, social support right now. But what we're also seeing is that it's putting family members at risk, and it's potentially putting your most vulnerable family member at the most risk, which is really difficult. And it's difficult to see in the hospital. We've had families that have multiple family members who are all affected at the same time, who one family member gets sick and might be at Boone, and as we're calling the family to give them updates, their kind of main decision maker and power of attorney, all of a sudden we can't get through to because they're hospitalized at the university or at another local facility, or being shipped even further away if we don't have beds locally, that we're not speaking with the patient's husband anymore or the patient's son anymore. We're speaking with a daughter-in-law or a more distant relative who's trying to kind of manage all of this. And it gets really complicated. And I've even had situations where, I'm talking with one family member and, after a family had gotten together for, what they thought of was just a dinner that kind of brings them together, not a huge group. But all of a sudden the grandfather is sick and the son is sick and some grandchildren are sick, and the daughter who I've been speaking to sounds worse and worse every time that I talk to her on the phone. She, is all of a sudden coughing and sounding more short of breath. And so every time that I'm calling to give an update on the grandfather, I'm also checking in to see how his son is doing over at a different hospital and providing some advice to the daughter-in-law and what she should be doing with her children who are still in the house. So we're really kind of trying to fight this battle from so many different aspects in the hospital, and being able to speak with such an incredible group of leaders, of faith leaders and pastors and rabbis, and who feel the same commitment to their community, who want to protect their community, but also be able to provide such an important support right now, I think is really the most important thing that I could be doing with my time, because being able to give advice and to be part of this panel and protecting our community, I think is truly what is going to save lives right now.
Dr. Grossman, thank you. I guess it's like you all are playing a role, such an important role right now in the lives of your patients, because the pastor can't visit bedside anymore. You're it. The family can't sit and hold their hand anymore. So it is incredible, the emotional drain that's on you right now and saving lives. So on behalf of the community, the faith community, I just want to say thank you to all of our doctors and nurses and aides and respiratory therapists and all of the others involved in walking through the hallways and the rooms, the janitors, the cleaning crew. This is just overwhelming. I think, Ashton, were you going to share a slide with us now? Because our time is passing fast and I know there's a lot of questions in the chat.
Yes. So yeah, thank you, Dr. Grossman, for sharing that. And we'll get to some questions, but first we wanted to kind of just do a quick overview of some of the different mitigation things that leaders in worship, places of worship can do to keep their congregants safe. And a lot of times when we're talking about these mitigation efforts, we compare or call it the Swiss cheese model, meaning that just like Swiss cheese, a lot of these mitigation efforts aren't foolproof. They have holes in them, so to speak. And so the more layers you have, the more prevention you have then in preventing the spread of COVID-19. So here's a quick graphic that we shared on social media a couple weeks ago that we used to explain it with wearing your mask, social distancing, washing hands, and cleaning and disinfecting. All of those things are so important on their own, but even together, they're so much more effective. And yeah, you go.
I would like to ask our participants on the Zoom call this evening, some of our faith leaders, what mitigation practices have you used to keep your congregation safe while you continue to meet the needs of your parishioners? Is there anyone out there who would like to share?
I will. I don't mind sharing.
Okay.
At our church, we just make sure to practice social distancing. The hand sanitizer, when members are coming in, they make sure to get the hand sanitizer at various locations. The temperatures are checked. And there's a portal that is used to ask the screening questions. So that's highly helpful to ask those screening questions first and to check people at the doors and get the temperatures checked and making sure germs are always wiped away with the hand sanitizer, social distancing, and of course, wearing a mask. And many people automatically will wear the shields as well. Kroger's, they sell those shields that you can wear. And you can also buy the eyeglasses to protect the eyes. So that's pretty much the preventative measures that is taking place. I myself, I make masks. And so the mask really helped to prevent the spread of COVID. It's not like a vaccine to stop it, but it can prevent it. And so when I make my mask, I make sure I use interfacing in between there and the filter, the little filter pouch, where you can just use regular coffee filters to insert to add that added layer.
So your congregation then has stayed pretty safe throughout this epidemic as you continue to meet, Carla?
Yes, I haven't had any reports because the way they have things set up, we would know as members if there was a case of the COVID within the congregation. And just like they send out the screenings prior to you even coming to church. And
okay, that's
we
good.
would know, yes, technology wise and through the information that they share.
So do you all have to make a reservation for the service you're going to attend? That's why you have screening forms to complete before coming to service?
Yes, each Sunday there is a link to sign up for services. So you have to make sure to sign up on that link prior to coming in. And when you come to the door, you have to show proof that you registered online and that you're allowed to be there participating, that you've answered all the screening questions.
Okay, good deal. Thanks, Carla. Is there anyone else out there who would like to share their mitigation practices?
I think Charlie Nylon, if I'm pronouncing that right.
Yeah, Verna, yeah. We at our church, we've been online since first Sunday in March. So the last time we actually had church was first Sunday in March, and everything on as a Facebook service. But one thing we did was we still had people who felt they needed to use the church for different things. So we set up everything. We took out all the seats except to allow 6 foot distance. We have hand sanitizer, things to wipe down. People when we come in, we have instructions on what people are supposed to do when they come in to the church that they have to use. So that's people coming to the office to get things like that. They're supposed to wipe down everything. We've had in September, October, November, we had an outdoor service in the parking lot with 6 foot spacing, with no contact between people, no handshaking, no hugging, anything like that. We had everyone wear a mask. Our pastor again spoke. She's the only person who actually spoke. She's the microphone. She's the only person who did that. We didn't have any singing. And then the other thing we did was we worked through our denomination on what they're recommending as far as a plan. And so we have a plan for what we would do when we reopen in terms of social distancing and things like that. We really hadn't figured out what would be an indicator on when we should try to hold services in person again. So that's kind of where we are.
Thanks, Charlie. Appreciate that. I don't know if there's anybody from Caris on the call, but I live next door to Caris, and I have enjoyed outdoor services all summer in the evenings because they're across the parking lot next to my house. And my husband and I just sat outside and enjoyed their services. And they were all spread out, distancing, and everyone had their own microphones, and it was really a pleasure. I'm going to miss that. Are there any other faith leaders on the call that would like to share any of their mitigation practices?
This is Jim. Can you hear me?
Yes.
Hey, I'm at the crossing, and thanks for organizing this. This is really, really helpful. It's just encouraging to be together and talk about this. I think I've just been kind of proud, I guess. That's kind of, I'm not sure if it's the right word, but I'm amazed at when we kind of lead with having our staff make sure that they're wearing masks and stuff. I have gotten very little pushback, even from people who I know would probably not be wearing a mask. They might not mask up as much as we're asking them to do, but I've found that people have been very compliant. It fits, it fits well with loving your neighbor, keeping each other safe. And so mask compliance has been pretty good thing. I think another thing that's helped us is to kind of walk the facility or walk the experience of someone who's coming to church and see where would there be a bottleneck? Where would I have to touch something can we avoid any of those things? And, so it's things like you end up propping open doors when you'd rather not, because in the summer it makes it, a little, you're wasting a little air conditioning, or in the winter it's a little chilly. But even like greeters, I'm just, again, I think it's pretty cool the way people are buying into, hey, let's keep each other safe. And so a greeter will stand there and hold that door open so that people don't have to touch that door. That's been really great as well. So it's it's been successful. Have we, I guess what I would also say is if you can provide masks. I know that's one thing that's hard to do, but we've tried to shop around to find some that were affordable. But sometimes people forget, and having a mask is great. I think the hardest part is if you do, whether you're doing reservations or whether you're just kind of spreading people out yourself. It is a bummer when people come and you get full. But again, I haven't had anybody that I've seen that really complained. Everybody kind of gets that a mask. I love the Swiss cheese slide. Everybody kind of gets that.
Yeah.
Social distancing and masks are great for cutting down the spread.
Yes. Is there anyone else before we move on to the slides that would like to share their mitigation practices?
Verna, this is Mike Aycock, Christian
Hi,
Fellowship.
Mike.
Hey, how are you?
Good.
Good. Hey, we're doing very similar things that everybody's mentioned. Our facility happens to just be set up in a way that we can bring people in our main entrance, and we have them walk through a kind of line, and they're seated by ushers, keeping social distance. And then we have them actually exit a different way, because we have two meetings, one at 9, one at 11. And so we try not to have backward traffic. We try to keep people going in just a flow out the building. And then we have volunteers that use one set of bathrooms because they're here all morning. And then we have, public bathrooms. And then I think I saw somebody else put on here that we disinfect after both meetings. And then we have a third service in the afternoon, and then disinfecting's done after that as well. So but yeah, the same things where everybody has to wear a mask. I think for us, if you're singing, we ask you to keep your mask on. We have allowed people to take their mask off while they're seated, as long as they're not moving around the building and they're socially distanced in our auditorium. So that's a little thing that if we were any fuller, we would have to have mask on all the time, but we keep our limit down to 100. So we're kind of, our size of auditorium, about 115, we'd be full with social distancing anyway. So we're basically looking at 2 meetings of 100 every Sunday. So, but we're trying to do the same stuff you guys are doing, trying to encourage people to keep those masks on, and lots of hand sanitizer stations around all through that path, people coming in and out. So.
Great. Ashton, would you want to go ahead and review the guidance? I don't know if Michelle is on the call, or Tracy.
Yeah, Tracy, do you want to go over some of these?
Yeah. I absolutely can. And and that's fine, we've got this up, but we can also, I did see some questions in the chat, I think. I don't really have it up right now. We will absolutely take questions after this. So I just wanted to let everybody know that. So we just wanted to kind of just elicit conversation from people and ask them. And then we were going to talk about the mitigation efforts that we are just, we are putting out there as recommendations. And then we definitely want to ask you questions. So, or ask if you have any questions. So the first slide we have up here is for your worship services in general. I do want to say this isn't a lecture tonight. These are just a couple bullet points for a few slides, but we're going to provide you with a one-pager of guidance. And so we'll elaborate on these slides a little bit more. And Ashton has already put it up on our website because she's magic. Okay. So basically, okay, I need to move myself over so I can read these slides, but that's okay. I'll figure out how to do all that. But anyway, so with worship services, obviously everybody can see the slide. Consider holding multiple services if you want everybody, to make it to your service. That way everyone can make it. You just have, it gives you more time to spread everyone out. And of course, if you're able to do remote services for your most vulnerable congregants, that's wonderful. Attendees should wear masks while indoors, when they are less than 6 feet apart. One of the things is that if people can really be spread apart, then our local order says that masks need to be used when you are less than 6 feet apart. The CDC recommends universal masking while indoors, and that's the best practice. And certainly when people are singing, and if you are spread apart about 10 feet, that's the best practice if you can't have a mask on. So we in our order do not require a mask when you can be 6 feet apart, but the recommendation is if you can, that's great. And that's what we were saying tonight. Encourage members to sign up for specific times so that you can, again, limit people and help maintain social distance. So, next slide. So that's for your services. And these are for gatherings after services. So plan gatherings that allow people to continue to wear masks and maintain social distancing. And then also anything that helps people. We're really big into saying that it's much easier to change the environment than to change people's behavior, because I forget sometimes. I don't always have a tape measure with me and know how far away I am when I'm talking to people. So just having those signs, I think everybody now is used to just something being there to just visually remind them, oh, okay, I'm about this far away, or I probably need to stand back here. So anything like that is helpful to put into your spaces. And when I say spaces, I don't even necessarily mean your actual place of worship. These are also little rooms, meeting rooms, and things like that you have throughout your spaces. And then also, as Jim was stating earlier about the congregating like in the spaces like a lobby or anywhere else, just making sure that you think about those areas where people may bottleneck or whatever, and that there's a really good flow through those areas. Weddings and funeral services. So they are the same protocol as worship services in that the actual service itself, the wedding itself, the funeral itself, is the same protocol as worship services. So in Boone County, it's just, there's not a capacity or occupancy limitation. It's just that you would social distance between each household. Now, when you are talking about a reception or a gathering after the funeral, we do ask for the capacity restrictions of the latest order and the social distancing requirements also. And social distancing means that whatever the masking requirement is, the disinfection requirements, and that spreading everybody households out by 6 feet. And then we also just put on there, sometimes we forget about all the little things around. So prompts or signs to help people remember to stay apart as they're doing all those things, to prepare for their wedding, and pictures. And we do understand that sometimes, of course, they may be in the same household, or they may be around each other all day and consider each other close contacts, but there are certainly a lot of more layers of people than that, people that come to assist with things, and just, those reminders, and by signs, or maybe by things that you give them beforehand, if they're using your facility, is just another good idea to mitigate risk for anyone using your facilities. Okay, and then gathering for the amazing service work that, all of our places of worship do and projects. This is, again, something that sometimes we don't think about. We think about the actual worship service, but sometimes things happen where we all get together to do something, especially this time of year for some of our faith homes. And so provide ways for people to sign up for a gathering or for service work, or maybe you're doing, you're putting together things for voluntary action, maybe adopt a family, all of those types of things. And so just making sure that you limit the amount of people and spread them out, maybe in a work area where they're doing their service work, and then also having a sign-in sheet, with check-in and check-out times. And this is an interesting one, because I have been able to see how it works with the contact tracing. If you have a drop-in group like a youth group, and somebody comes in for the first 20 minutes, but then they're not there, for the last 30 minutes or the last, hour and a half, whatever, they're not even contacts. So that's really helpful for, especially if people are trying to remember where they were when they were during your youth group or something else, that may be helpful for a drop-in type of situation at your faith home. Okay, so this is another slide we put together because we know that places of worship also, you are dependent, on the financial health of your church or your faith home. And it's very important that you continue receiving your donations and receiving your tithing so that you can continue to do the important work that you do. So the only suggestions and recommendations we make is doing something different than passing something around, trying to figure out how to do that. Perhaps it could be online, and there's all kinds of online donation options too, so that things just aren't frequently touched. So this is the time where we will get questions. I'll have Ashton monitor this part.
Can I mention one other thing that?
Yes, please.
I wish I had mentioned earlier. So, a lot of what I spoke about was kind of the perspective of being in the hospital and caring for patients in the ICU. But I also have the perspective of treating patients who have, the majority have chronic lung disease. The majority of my clinic patients are elderly, are in the mid-Missouri area, and are very, very religious and very much so missing their religious connections right now. And so one thing that I've addressed at almost every clinic visit with patients since March is, how patients are doing at home, how they're able to get exercise when they aren't able to go to the ARC right now, and they're kind of losing some of the muscle tone that they've fought to get back, and how they're doing in terms of not seeing their family, and how they're making those connections, and what are they doing about church. And I would say the majority of my patients are not going to church right now. They're doing the Zoom option, or they just aren't feeling safe enough to go. And I think, some of that is me encouraging them that they need to find ways to connect, and to spiritually connect, but also to really keep themselves safe. And the only way to truly keep yourself safe is to wear masks and stay social distanced, and for other people to wear masks around you. And a lot of what I've heard from my patients over the last few months is some frustration with some of their local churches, that they don't feel like, even if they've spoken up in church, that why isn't it more recommended that people are wearing masks, and that they don't feel like they're fully protected there. And so I think that's one really important thing to think about with your congregation, is that, you know, you're providing this amazing service of support for people who really need it right now. But you also have to think about the patients who you aren't seeing at church right now. And the patients who you are seeing at church, but they're the only ones who are in masks and they look a little bit uncomfortable. Or who are coming in masks and taking them off because they don't feel like they don't want to be the only person in a mask, but they're really deep down not comfortable not wearing a mask and feel like they're putting themselves at risk, but kind of willing to take that risk for the emotional and spiritual needs that are getting met. But you know, if we can provide some way of making sure that those congregants are feeling protected as well, I think is really, really important, and is something that I have heard very consistently from my patients who are, you know, the most vulnerable patients right now.
And we appreciate that so much. We have gotten emails into our business guidance that have said the same. So thank you very, very much for adding that. And yes, because we absolutely want all of the people who would love to go to their spiritual home and feel comfortable to be there. They need it just as much as everybody else. So this is a time where we're going to ask for questions, but I just wanted to really quickly say that email is an email that we have a team of people who can answer any questions about either our guidance or questions in general, or we have actually an operational plan is not needed for worship services at all, but we have looked at them for some of the faith homes that just want us to look at them to see what they might be missing or what would be helpful, especially if their congregation increases or they do something different and they add more services or whatever. We're happy to do that. That's something that's a service that we're happy to do. So I'm going to hand it over to Ashton to kind of monitor the questions.
Yeah, thanks. So if anyone has questions, please put those in the chat. I know we've been getting them for a little while, so I'm going to kind of sift through and I'll toss it to whoever I think can best answer it. But if anyone else wants to jump in after, you're more than welcome to do that too. So we had a question early on about, is there a safe way to have a church dinner right now? And I think maybe Tracy, even for guidance, or Dr. Milla might want to answer that.
I'm happy to answer that. The only way to really have a safe church dinner is to use restaurant guidance almost, which is to keep people in their own households separated out by at least 6 feet, and have nothing, the food not be touched by, serve it cafeteria style. The issue with dinners and things is that you're there for a long period of time with your mask off eating. And so it would take something that would be, a one risk, which is everyone getting together with masks on and meeting maybe for, Bible service or something. And then the minute you take masks off to eat and sit, that increases your risk. So I would say that, again, we do look over plans for things to do, because sometimes that would be considered a gathering that, especially if it goes above 100, we would, want to help you with the plan. So our order allows for that. But we would say that there would have to be a lot of mitigation strategies to make sure that it is as safe as possible.
Yeah. There are a few for Dr. Grossman. Are you able to give a little bit of a demographic breakdown of the patients that you're seeing in the ICU?
I think it has varied actually. We have seen different demographics at different times during the last 9 months. My personal service the last few months, I would say the majority of my patients are elderly, they're white, they're rural, and they're Christian. That has been the theme that I've seen. It's not necessarily, something that I would say is universal, but from my experience the last few weeks on service, that's been the majority of my patients right now.
And then someone was curious too of how you are preventing yourself from becoming infected with the virus, like, what you do once you get home after being in the hospital all day.
That's a good question. So I am the hugest fan that says that masks work. I have certainly gotten nervous a couple of times and felt not well and gotten myself tested and been negative. Out of curiosity, I got my antibodies tested to see if maybe I had COVID, and I just.
Oh, you froze for a second.
In April, and in the ICU, kind of in the highest risk situations with patients on BiPAP machines and high flow cannulas that aerosolize the virus. I intubate patients if they're not doing well in the ICU, which is one of the higher risk procedures. And I do bronchoscopies in the hospital on patients who we've tested first to make sure they don't have COVID. I wear a mask at all times in the hospital. I wear a mask at all times out of the hospital. I honestly feel safer in the hospital wearing my mask around colleagues who are wearing their mask and being careful than I do at Walmart and other places of business where people aren't necessarily wearing masks. I think masks work. I think social distancing works. I think hand hygiene works. I use so much hand sanitizer at work and at home. I've done this since the start of the pandemic. I've been very careful. My family's been very careful. I'm not from Missouri. I'm from New York. So I have family in New York, and my in-laws are in New Orleans, and we have not seen our parents and grandparents since Christmas last year. We are taking this as seriously as possible because we want to keep our family safe and we want to keep ourselves safe, and we want to be able to continue to do what we do. I think leaving the hospital, I change my clothes before I leave into a clean set of scrubs, so I'm coming home in a clean set of scrubs. And I still come in through the basement, and I shower before I see my family. And then I act normal other than that. Same hugs, same cuddles. But I am very, very careful when I am around other people because I think it's the most important thing I could do.
Absolutely. This next question might be good for Dr. Millam, because I know we've gotten it at the health department before, something similar. What positivity rate do you think would be good to gauge when you can recommend to be able to meet in person again for a place that has been online?
Yeah, that's a great question. I would not base it on one variable alone. And so there's a whole lot of very important factors. And so especially whenever we're talking about ways to decrease transmission, I think we really have to factor in a whole lot of variables. So the positivity rate is important, but also our hospitalization rate, our overall number of new cases and active cases. There's a whole lot of variables that we're looking at. And also this is still a relatively new illness. And so we're continuing to see new data and new research come out too, telling us what variables are most important to guide these strategies. And so I wish I could give you a very straightforward single answer where at this bar, this is whenever X, Y, or Z can happen. But I think the smartest thing we can do is continue to listen to what the data is telling us and really go into it with open minds and open eyes with this. And as we learn more about it, and as we see how the trends are going, be able to make the decisions with the best information we have at that time. And the best information we have in a month from now is probably better than the information we have now.
Yeah, absolutely. Sorry, reading while I'm scrolling here. Linnell, you might know some about this with different findings, but can you talk a little bit about asymptomatic people, and how do you navigate that with what we know about asymptomatic carriers?
Well, so there's kind of two different types of asymptomatic. There are people that do not have symptoms yet, but 48 hours before symptom onset, we know they're infectious. And then you have people that, for whatever reason, they're lucky enough, they were asymptomatic basically through the entire course of their disease. Also potentially infectious people. So I think for church purposes, the way we thought about that is if you have, we basically plan things with the assumption that at any given time we have a COVID positive patient in the church. And probably unwittingly, inadvertently, they don't know that they have COVID. So we know that close contacts are those people that are within 6 feet for more than 15 minutes. So the big goal is to not have people within 6 feet for more than 15 minutes, so that even if you have someone with COVID in your church, your fellow worshipers would not be considered close contacts. And so that's the whole name of the game, and it works. We did have a situation where someone was asymptomatic and they found out the next day they had COVID, and they had been in a meeting, and we were all sitting 10 feet apart. We wore our masks the whole time. No one was considered a close contact. So it's practically speaking, that's the way to think about asymptomatic people in your church. And I don't know if Tracy has anything to add to that.
No, I don't. You did. No, it was great.
Yeah. Dr. Grossman, you've talked a lot about ICU, obviously, and the patients you're seeing. Could you speak a little bit more about some of these long-term effects that we're seeing in people?
Yeah, that's a really good question. A lot of what we're seeing in the ICU, in terms of kind of how to interact with patients and families and how to give advice, it's very kind of concrete in that there's an acute situation going on and we're trying to manage something very acutely to get them through this situation, to get them back towards their home life. What we really need to think about, though, is that there are going to be repercussions from this virus that are way longer lasting than just an ICU stay. And it's not just in patients who have been in the ICU. We're seeing what's being called long haulers, which are patients. There's kind of two versions of long haulers. There's the version of patients who were really sick and they continue to have symptoms, and they continue to have symptoms because they have long-lasting damage to their lungs, to their heart, to their brain, to their nerves, to really truly any organ system that you can imagine. And then we're seeing long haulers who continue to be symptomatic, who continue to be exhausted, and we search for, kind of organ involvement. And while we don't see organ involvement, we know that they're not feeling right and they're not back at their baseline. And these are really frustrating patients to treat. Because they truly don't feel well. We don't have an exact answer for them of why they're not feeling well. We're hoping that future research, kind of guides us in how to best care for them. And we believe that they're not feeling well and that they're still symptomatic from this, and just kind of have to give them validation for that. And oftentimes these are not, the elderly patients who are coming in. These are young patients. These are patients in their 30s who did not have severe COVID initially, that weren't hospitalized, that, did pretty good initially and continue to have symptoms for months and months. So, the long-term repercussions of getting this virus are still not fully understood.
Yeah.
Thank you, Dr. Grossman. We're at the top of the hour. This has been great, but I want everyone to understand that this has been recorded. So it'll be posted later on, or almost immediately, knowing Ashton. But if you have any questions that were not addressed or answered during this call, you can email your questions to businessguidance@como.gov. I want you to know that our faith community is very important to us, and we appreciate what you're doing. The slides, will they be available, Ashton?
They will online with the video, but also if you want to email us, we can get those to you directly as well.
So if you want those slides directly, just request them at businessguidance@como.gov, and we'll be sure that you get those for your use.
Yeah, absolutely. And one more question that if you could answer via email, if you'd like, is just how can we help you more? You know, at the health department, our guidance team, we want to do everything we can to keep you all and your community safe. So if you have any ideas, or if there's anything that you're struggling with, you want more advice on, please reach out to us. We are all more than willing to help however we can.
Can I make one final plug?
Sure.
I know that this is a Boone County initiative, and you know, I clearly work at Boone Hospital and service our community, but we also service 25 other counties that we get patients from, and the majority of patients that we see in the hospital are from these rural counties that do not have mask mandates, and that don't have, you know, as you know, as much guidance. And so any faith leaders who are on this, please, if you know other faith leaders out in the more rural communities, please forward this on to them, and because we want to be able to keep all of our mid-Missouri family safe and as protected as we can, and we want to be able to provide the best care that we can for truly the whole area.
I couldn't agree with that more.
With that being said, I want to thank all of the panelists. Dr. Grossman, your view from the ICU is very much appreciated, and just and the pastors and the faith leaders and all that you're doing out there to meet the needs of your congregation and keep everybody safe is very much appreciated. As Ashton has asked, if there's anything we can do as a health department to help you, please email us at businessguidance@como.gov. We're here to support you. We're here to serve you as both of us, the team, keeps our community safe. Thank you.
Thank you all. Thank you for attending.